Our next guest is speaking out against the president's health care plan and says that government-run health care killed her father.
Lori Roman is a concerned citizen and founder of RegularFolksUnited.com. Good to see you this morning, Lori.
Good morning, Gretchen and Steve.
Good morning.
All right, so your father, whose birthday, by the way, would have been today, correct?
Correct. He would have been 89 today.
All right, we're looking at a wonderful picture of you with your father. A lot of people focusing now on the health care reform bill and obviously what it could possibly do to those people who are over 65. Tell us your story about your father.
Well, the first thing that surprised me was that as soon as my father was diagnosed with dementia, even though his face and smile still lit up a room, every room that he went into, even though he was still active and healthy and very happy, the doctor, in a routine checkup, did, I guess, what is now known as end-of-life counseling with us, unsolicited, recommended that I put a do not resuscitate order on my father, recommended that if my father got sick that we really just give him comfort care and that we not treat his illness. And I felt pressure from the doctor to really hasten my father's death if he should become ill. And I fired that doctor.
Good.
But I found out that this seems to permeate the system after my father was admitted to the hospital with a kidney infection, completely treatable by antibiotics, and another doctor recommended that we didn't have to feed my father now that he couldn't eat on his own. And I shot back at that doctor, I don't believe in starving old people, do you? And I expect you to treat my father like you would treat your own father. And everywhere I turned, I seemed surprised that because my father had dementia, it seemed that under the Medicare system, there was encouragement not to treat him properly. In the end, he was discharged from the hospital under Medicare rules because of that kidney infection. While he still had a fever, he still had an infection, but his temperature fell 1/10 of 1 degree short of the Medicare guideline for hospitalization, and he died shortly after that.
So, Lori, what you're worried about is that if the president's initiative goes through, as you know, with these end-of-life panels and stuff like that, that what happened to you will happen to, if not all of us, a lot of us.
I'm worried that it's already happening. I'm worried that it will get worse with more bureaucracy and more rules. And to have a doctor say to you, my hands are tied. The Medicare rules say I have to pull this IV antibiotic out of your father's body, even though it's healing him, even though he's getting better. To know, I don't want a bureaucrat between my doctor and my loved one. And I just think it will get worse. I worry when I see comments that I've seen from one of the healthcare advisors to the White House. In 1996, Ezekiel Emanuel made a comment about not needing to care for patients with dementia, that they did not have required medical care because they had dementia. So I worry about other people like my father, and I worry that they're going to define quality of life. And I'll tell you, dancing with my dad those last few days, playing Glenn Miller songs with him and seeing his face light up, I don't want someone else defining what's quality of life.
So many people can relate to what you're talking about because we've all had parents and we all love them. So we have an understanding of what you're talking about. Lori Roman, thank you so much for being our guest this morning.
Thank you.
You bet.